Today, surgical operations are routinely carried out while patients are completely unconscious. The patient is under the care of the anaesthetist, who uses sophisticated equipment to monitor how they're doing. But the anesthetic drugs and equipment which we take for granted today are a relatively recent innovation. It was only in the 1840s that anesthetics such as to be employed. These were widely used until quite recently. The method of application was simple. A mask was made with thick layers of gauze, placed over the patient's nose and mouth, and the ether, or chloroform, dripped slowly onto it. When everything was ready, the process began on the conscious patient. Many people still remember this experience, and most found it extremely unpleasant.
You won't mind this a bit, my dear. Just easy does it.
The use of ether or chloroform was unpleasant for the patient, and it could take 15 minutes for full anesthesia to be achieved. Even in the 1960s, problems were experienced.
Very nice.
But you got it over my nose.
Uh-huh. There we go. How's that? A little better? Very good. All right. Don't worry about it, dear. You're doing just swell.
Take a big breath to sleep.
That's right. Just breathe it in and go to sleep.
Well, hold on.
This patient is experiencing some degree of excitement.
By the First World War, another anesthetic, nitrous oxide, was used with ether or chloroform to more effectively anesthetize patients. This development became the basis for anesthetic procedures for many years. Nitrous oxide was administered with a mask, and then ether was employed for deeper anesthesia. From the 1930s, barbiturates began to be used to make the patient unconscious prior to using nitrous oxide and ether. This made the whole process much more comfortable for the patient. In the 1940s, another development was the introduction of muscle relaxants. Before their use, surgeons encountered significant problems.
As it is today, the muscles of the abdomen were often so tight that when the final incision was made, the organs burst forth through the wound. This meant that sometimes the organs inside were damaged. Also, the muscles in the side of the incision sometimes hold the edges together so closely that it's extremely difficult to work in the depths of the wound. In order to counteract this, a very big incision was occasionally necessary.
In the 1950s, another major step forward was the introduction of fluothane. This was easier to administer and significantly safer than chloroform, and came into widespread use.
You can see that since fluothane is such a potent anesthetic, that induction is usually rapid and generally smooth.
One problem with the development of some of the new anesthetic techniques was that they affected breathing. This meant that a patient's lungs had to be rhythmically inflated by machine. However, patients could remain unconscious for longer, enabling more complicated operations to be undertaken more easily. It is clear that since the Second World War, the development of new chemicals and medicines have transformed anesthetics. The experience of undergoing surgery is now dramatically less traumatic than it was a lifetime ago.